My name is Dr. Karen Danvers Perez, and first I want to say that this video and all my videos are for educational purposes only. I am not a medical doctor, I'm a doctor of nursing practice. So for the next couple of videos, I'll be doing some definitions as it relates to maternity, okay? So these are just definitions. And I may go in a little bit on a certain characteristic of the word, all right? So let's get into it. So the first word is infertility. It is the inability of a sexually active couple to conceive pregnancy after a year of regular and unprotected intercourse. So it could also be a woman's ability to carry pregnancy to full term. So a lot of factors plays into this. It's not just only on the woman. It could be factors such as the quality and or the quantity of the sperms. It could be a blocked fallopian tube. It could be hormonal imbalance or abnormalities. It could be endometriosis. So many things can cause infertility. So the thing that I want you to remember is just that it's the inability of sexual active couple to conceive after having sex regularly for 1 year unprotected. Okay. So the next word is genetic counseling. So genetic counseling is a specialized healthcare service provided by a trained professional known as genetic counselors. So the primary goal of genetic counseling is to help individuals make informed decisions about their healthcare reproductive choice and family planning based on their genetic risk factors. So genetic counseling assess an individual personal and family medical history. They also perform risk assessment and explain potential genetic complication for certain conditions. So in a pregnant woman, there are certain diseases that if a woman has the gene or genetic genes, it will more likely pose a risk for the newborn to born with this specific disease. So a woman or a couple may go in for genetic counseling, and it will also be deciding factor if they should get pregnant, if they should have an abortion, if they should carry the baby to term, the fetus to term. So many factors rest on genetic counseling as it relates to family and family history. So the next one is cervical sponge. So cervical sponge is a type of birth control method designed to prevent pregnancy. It is a soft, round device made by polyurethane foam that is inserted in the vagina before sexual intercourse. So this is the vagina. Here is the cervical sponge that covers the cervix that prevent the sperms from going into the uterus. So while it may prevent pregnancy, it doesn't prevent from sexual transmitted disease. So one of the things with cervical sponge is that the woman is advised to use what we call spermicide to immobilize or kill the sperm. So in addition to blocking the sperms from going up, spermicide will help either immobilize them or to kill them. Our semen analysis. So a semen analysis is actually is a multiple test that's done in one. So they're looking at sperms count. So they're looking at sperms count. They're counting the number of sperms present in a given volume of semen. A healthy sperms count is typically considered to be around 50 million or more sperms per milliliter of semen. So I want to say this. One of the things that can affect infertility, as we spoke about, is reduced sperm count. All right. So that's why this is very important to analyze, especially if someone is trying to get pregnant. This will be they could use this test to determine if there's something wrong with the semen. In addition to that, I want to add that semen is the substance that contains the sperms and other fluid. So remember that sperms is not necessarily semen. the sperm is in the semen, is in the fluid. It's made the collection, the fluid and the sperms make up the semen, okay? So with the semen analysis, they'll look at sperm's motility. So the percentage of sperms that exhibit progressive movement and swim in a forward direction. So a high motility is important for sperms to successfully reach the fertilized egg. Sperm's morphology. So this is assessment of a sperm shape and structure. Abnormalities in sperm's morphology may impact the ability of the sperms to penetrate the egg. Sperm's volume, the total amount of fluid ejaculated during orgasm. So a normal semen volume typically ranges from 1.5 to 5 milliliters. The pH level, the acidity and the alkalinity of the semen is very important because, as you know, that sperms cannot stay in an acidic environment. The liquidification time. So this time is the time it takes for the semen to change from a gel-like state to a more liquid form after ejaculation. So normally this time is usually within 20 to 30 minutes. All right, so this is semen analysis. The other word is coitus interruptus. So this is also known as the withdrawal method or the pull-out method, and it is used as a form of contraceptive technique in which the male partner withdraws his private part from the woman's vagina before ejaculating during sex. The goal of this method is to prevent the sperms from entering the vagina and reaching the cervix, thereby reducing the chance of fertilization and pregnancy. Let me add that this is one of the least effective form of birth control or contraceptive technique. It is one of the least effective form. All right? So let's look at implantable progestin. So implantable progestin is often referred to as progestin implant, and this is a form of long-acting reversible contraception. So this involves insertion of a small flexible rod under the skin, as noted here in this diagram. So the rod contains a synthetic hormone called progestin. So now this is slowly released into the bloodstream over time. So the progestin implant is designed to provide effective contraception for a specific period of time, typically around 3 to 5 years, depending on the specific brand and the type of implant. So some of the benefit is the contraceptive mechanism is that this works by thickening the cervical mucus, and this makes it difficult for the sperms to penetrate the egg. Long lasting, as I mentioned, once it's inserted, the progestin implants provide a continuous contraception for a long period of time, 3 to 5 years. It is reversible, meaning that if the woman do decide to get pregnant, it is removed and the woman will be able to conceive. It is highly effective because there is a low failure rate when it's used correctly. In addition to that, ease of use. Once the healthcare provider put that implant most likely in the forearm, upper part of the arm, then the woman don't have to remember to take pill and say, oh, I forgot a pill. So it's easy to use in that sense because one put in, then it is good. It's also discreet and it doesn't interfere with anything. Now, one of the things is that some users, may say that they have a lot of periods. Some say they don't have any period at all. So there are some of the key features with this. The next word is diaphragm. So you're going to see that the diaphragm look like the sponge in which we discussed early on. So a diaphragm is a barrier method of contraception that is designed to prevent pregnancy by blocking the sperms from entering the uterus and reaching the egg. So it's a shallow dome device made by a soft silicone or latex that is inserted into the vagina before intercourse. So you see this word latex, just be careful, because if someone is allergic to latex and they can't use that form of or that brand of diaphragm if it's made from latex and they're allergic to latex. So the diaphragm covers the cervix, just like the sponge. The entrance of the uterus, and it acts as a physical barrier to prevent the sperms from meeting the egg. So one of the things is that the woman should make sure that it's stored in a dry place. The woman should look at it each time before using it to make sure that there's no hole or there's no tear inside there. Again, it doesn't help prevent sexual transmitted diseases. So as it relates to the usage, the diaphragm is used in combination with spermicide, just like the sponge, right, to help immobilize or to kill the sperms. As it relates to size and fit, diaphragm come in various sizes. So if the woman gain excessive weight, 5 to 10 pounds, or lose excessive weight, then she needs to tell the healthcare provider, because then she can get another one. It will not be effective if the woman gain or lose a certain amount of weight. Insertion. The diaphragm is folded and inserted into the vagina, so it covers the cervix, and it should be inserted before sexual intercourse. The effectiveness, the effectiveness of the diaphragm depends on the usage and the consistency of using it, and also making sure that the woman check it so that it doesn't have a hole and it's not deteriorating. It is placed in a dry cool area. For protection, I did mention that it doesn't protect against HIV or STIs or STDs. It is reusable. The woman can wash it, store it properly, and it can be used again as long as it's not damaged. It is good. Personalized, the diaphragm provides a woman with a more control over contraception. Instead of depending on the man to put the condom on, then the woman have control that she can use the diaphragm. Although I mentioned that while condom does prevent against STIs or STDs, the diaphragm does not. All right. Abstinence. Abstinence is a voluntary decision to refrain from engaging in sexual activity, specifically vaginal, anal, or oral intercourse. So it's a method of contraception and sexual health practice that involves avoiding any form of contact or sexual contact that can lead to pregnancy or transmit any kind of sexual transmitted infection. Abstinence is considered one of the most effective methods of preventing both pregnancy and STI, because no sex, you can't get pregnant. No sex, your risk for STI, sexual transmitted infection, or STD, sexual transmitted diseases, decrease drastically. So here are some of the key points. No sexual contact. Abstinence involves non-participating in sexual activity that include exchange of body fluid. It is 100% effective. As I mentioned, no sexual contact, no risk of getting pregnant, and reduces the risk of STI. There's no hormonal, there's no device. This is a personal choice that the couple may make, or the woman or the man may make. Communication, open communication between the partners are very important when choosing abstinence, and both partners should agree. Physical and emotional health. So abstinence can provide physical and emotional benefit, including prevention from unintended pregnancies and STIs. Abstinence education. Now they have this in high school or even middle school, teaching children about abstinence. And there's also other programs within the community. Practicing abstinence can be very challenging, but is very effective. Individual and cultural factors play a great role in abstinence and transitioning to other methods. So if the individual chooses to become sexually active in the future, it is important to have knowledge about what other contraceptive and other method of preventing STIs or STDs are in place. Intrauterine device, so which is also called IUD. So it is a small T shape as noted here on the screen device that is inserted into the uterus to prevent pregnancy. It is a highly effective method of contraception and offer a long-term protection without requiring any kind of daily attention. There are two main types. There is the IUD copper and there's also the hormonal. So here's how the IUD works. It works by altering the uterine environment in a way that prevent fertilization and implantation. So for the hormonal, these releases a small amount of synthetic hormone called progestin. Remember, we talk about the progestin that goes in the forearm. So progestin, but it's in the form of a uterine device. And what it does, it thickens the cervical mucus, make it difficult for the sperms to reach the egg, and it also thin the uterine lining, make it less receptive for the fertilizer to implant. So for copper do not contain any hormone. Instead, they have a copper wire coil around the stem of the device. So look here. So this is a hormonal. Here's a copper. So it has a copper wrapped around the device. Okay, the copper creates an environment in the uterus that is toxic to sperms, thus preventing fertilization. Copper UIDs do not affect ovulation. All right. So ovulation. So ovulation plays a key role in pregnancy. So it is the event in the menstrual cycle of a female where the mature egg is released from the ovaries. It is a critical step in the reproductive process as it marks the period during which the fertilization by sperms is most likely to occur. So let's look at this. So most time it's so common for women to start counting the day to calculate their menstrual cycle the day after their period ends, and that is not correct. When your period starts, that's day one. So typically, and this is just an average, menstrual cycle is 28 days. Some may be longer, some may be shorter. Alrighty. So in the follicular phase, this is where the menstrual cycle begins with a follicle phase. During this phase, you have the follicle stimulating hormone is released by the pituitary gland, stimulating the growth of multiple ovarian follicles. Each follicle contains an immature egg. So during this time, you have the follicular phase. All right. So in the ovulation phase, which is about day 14, so from the day the woman starts seeing her period to day 14, she's more likely to get pregnant at day 14, give or take 1 or 2 days before or after. So remember that the ovulation phase plays a key role in pregnancy, and this is where the egg is released from the ovaries. In the luteinizing hormone phase, this is a surge of luteinizing hormone is triggered by the hypothalamus in response to a raising estrogen. And then you have, this is the luteinizing hormone surge triggers ovulation. Okay. So again, ovulation plays a key role. Don't forget that. In pregnancy, as that's when the egg is released and more prone to be fertilized by sperms. Okay. Morning after pill. So the morning after pill is also known as the emergency contraceptive. It's a form of birth control used to prevent pregnancy after unprotected sex. So it is intended to be used as a backup option when regular birth control methods fail, or it's used incorrectly, or it's not used any at all. So there are different types or different reasons why someone will use it. Unprotected sex. If intercourse occurs without contraception, like you said, oh my gosh, I forgot to take my pill, or we didn't use a condom. Or if the couple did use a condom, but the condom break, or the diaphragm slip out of place, or they forget to take the birth control, or the woman missed her pill, that's the reason to take a morning after. Morning after is not an abortion pill. So emergency contraception should not be used as a form of abortion. It prevents or delay ovulation and fertilization, and may also affect the lining of the uterus to prevent implantation. So while the emergency contraception can significantly reduce the risk of pregnancy, it is not 100% effective. So if pregnancy does occur despite taking emergency contraceptive, it's important that the patient go and see the healthcare provider. It should not be used as regular birth control. It should only be used as a backup option. This is intended for occasional use. So as I mentioned, if you're the nurse working in the clinic and you notice that this person is saying that they're taking Plan B often, then it's as a nurse or a healthcare professional that works in this kind of setting to educate them on that it's not a birth control, it's not a form of contraceptive. All right. So couple of the side effects is that they may have nausea, vomiting, change in menstrual cycle, breast tenderness. And again, this does not protect against STDs or STIs, okay? Clomiphene citrate. So this is commonly known as Clomid, and it's a medication used in the field of reproductive medicine to treat certain cases of female infertility. So it's often prescribed to women who struggle with ovulation issues. So the mechanism of action, here's how it works. Now, it is classified as a selective estrogen receptor modulator. It works by blocking the negative feedback mechanism that normally inhibits the release of what we call the gonadotropic release hormone and the follicle stimulating hormone and the luteinizing hormone from the pituitary gland. So when it inhibits the feedback loop, then the level of FSH and LH increases. When this increases, then it stimulates the ovaries to produce and release eggs. So indication, clomiphene citrate is primarily prescribed to women who are having difficulty ovulating, and it is commonly used for a couple of situations. Like, for example, it is commonly used for women with polycystic ovary syndrome, also used for women with ovulatory dysfunction. So that will be some of the reasons why women will use some of these medications. So thank you again for listening to another video. Please stay tuned for upcoming videos on definitions that were requested. All right. Thank you for watching.